I was volunteering in an organization in Philadelphia that was serving individuals living with HIV. And I looked around the room, and all of the people around me were nurse practitioners. And what they were doing is they were providing holistic care for these individuals in a way that was far exceeding their clinical needs. It was talking to them about their psychosocial needs, their spiritual needs, their economic needs. And I turned to one of them and I said, I want to do what you do.
All of this has been a step by step procedure, because in the beginning we were trying to carve out something new. Our education had to be done by physicians because there were no nurse practitioner faculty or role models for us.
I mean, we were physically the others. We were physically moved to the VMI building. We were not even in the School of Nursing. And that said a lot. And I think a lot of people that came to the program early were there because they were not satisfied with traditional nursing roles and wanted to be better able to take care of patients and families.
There was also the issue, are you all just trying to be junior doctors?
Yeah.
I remember I used to say to my nursing colleagues, come see us as providers and then make your judgment.
Half a century, right? That's powerful. It highlights how far we have come and how the profession itself continues to evolve and grow and meet the needs.
Now we only educate our nurse practitioners at that level of a doctor of nursing practice, which is really important because we're helping our students not only be expert clinicians, but also change agents. So our students are learning how to identify problems, identify solutions, and stand up for the change that they see needs to be made in order to create a better future for our patients, for our communities.
You know that inside you that you want to do so much more, but there's so much policy and all these things that are obstacles in the way. Having the DNP, the Doctorate of Nursing degree, that gets you a seat at the table to where you can go in an organization and you can really implement change. But as I'm sitting at that table, I'm not only advocating for myself, I'm advocating for all the people that are on the front lines of nursing.
Nurse practitioners have always filled the gaps where the gaps existed. And we are problem solvers, we are collaborators, we're fixers, we're doers. And now we're hearing we need to be more mobile. There are healthcare deserts and gaps, and so it's not enough for us to just have a brick and mortar someplace. We need to be mobile and go to where people are.
Today, like in 1971, they're talking about a physician shortage, a nursing shortage, a primary care shortage. So some things have not changed that much.
The whole world of healthcare is recognizing that. Nurse practitioners are playing a critical role in helping being part of the team to give quality healthcare, which is what we're all about.
I think the healthcare field is changing and our focus is changing. In order to solve big problems, nursing is being recognized as change agents, and the tools and resources that we're bringing to the table are truly being utilized.
It's all about passing the baton, and I think that that's what VCU embodies, that the faculty are playing an instrumental part in passing the baton to the next generation of providers.